Top 10 essay topics about intensive care. Implementation of physical restraints in the intensive care unit. This essay could delve into the controversial topic of using physical restraints in ICU settings. What are the reasons behind their use? Here, you can discuss ethical considerations, potential benefits, and drawbacks. Also, we suggest including discussions on alternatives, patient safety, and the balance between restraint usage and patient autonomy. Early mobility therapy in the intensive care unit. We recommend exploring the significance of early mobility therapy in ICU patient care through this essay. Cover the benefits of promoting the movement. Clarify potential risks and the impact on patient outcomes. Besides, you can discuss evidence supporting early mobility therapy, implementation challenges, and strategies for successful integration into ICU protocols. Management of burns in intensive and acute care. Here, you can focus on the specialized care required for burn patients in intensive and acute care settings. Detail the stages of burn management. Include here assessment, wound care, infection prevention, and pain management. Furthermore, you can discuss interdisciplinary approaches, technology advancements, and psychological support for burn patients. Bloodstream infections in intensive care department. In this essay, you may dive into the prevention and management of bloodstream infections in the ICU. Explain the risk factors and common pathogens. Shed light on the importance of strict aseptic practices. We also propose discussing central line-associated bloodstream infections, clap size, antibiotic stewardship, and strategies for reducing infection rates. Evidence-based practice in the intensive care unit. What is the role of evidence-based practice, EBP, in ICU care? Highlight the question in your paper. Cover the steps of EBP, from research review to implementation. Emphasize its impact on patient outcomes and safety. Moreover, you can clarify barriers to executing EBP in the ICU and strategies for promoting a culture of evidence-based care. Medication errors in intensive care unit. Medication errors in the ICU are a complex issue. We recommend discussing its implications for patient safety in this essay. Describe the causes of errors and strategies for prevention. Explore the role of technology in reducing medication-related risks. Also, you can underline the importance of communication, double-check procedures, and continuous staff training. Having visiting hours in the intensive care unit. Should there be visiting hours in the ICU? Examine the pros and cons of the decision in your paper. You may review the potential benefits of emotional support for patients, family involvement, and challenges related to infection control and patient rest. It's an excellent idea to include examples of visiting policies from different healthcare institutions and their impact on patient experiences. Nurse staffing, medical staffing, and mortality in intensive care. What is the relationship between staffing levels and patient outcomes in the ICU? Study the question in your essay. We propose analyzing studies that explore the impact of nurse-to-patient ratios, physician availability, and multidisciplinary collaboration on mortality rates. Also, you could consider the challenges of maintaining optimal staffing and strategies for improving patient care through adequate staffing. Intensive care unit standards and services. This essay should focus on the standards and services that define high-quality care in ICU settings. Here, you can explain the accreditation processes, regulatory guidelines, and best practices that ensure patient safety and optimal outcomes. Furthermore, scrutinize innovations in ICU design, technology integration, and patient-centered care approaches. Resuscitation of patients in intensive care units. We suggest researching the intricate aspects of patient resuscitation within the ICU environment. Cover advanced life support techniques and ethical dilemmas related to end-of-life decisions. Stress the importance of clear communication among healthcare providers, patients, and families. Additionally, you may highlight the role of palliative care and psychological support during resuscitation efforts.